So lumbar microdiscectomy is probably the commonest spinal surgery operation. That procedure involves removing a bit of herniated disc that's pressing on a nerve. Generally, the surgery is done for leg pain. There's some evidence for operating if the person has a leg weakness, but the main indication is for pain. Patients often have sensory impairment with pain, but the sensation takes much longer to recover than the pain after a microdiscectomy. So under general anesthetic, the patient is placed face down in a curved frame, which arches the back, which enables you to, that stretches the spinal interspaces, so it makes the surgery technically a little bit easier because you have more space. You'd make a cut either in the middle or just to the side of the midline, depending on where the disc herniation you're trying to reach is. You then make a skin incision and go just to the side of the paraspinal muscles to reach the interspace where the disc is that you're trying to reach. We then confirm that we're in the right spot with X-ray, and I use a small spike retractor to open the cut, so you have a small window to look down. You then remove the soft ligament that joins each spinous interspace. Once you've removed that, you usually see the swollen nerve that's often a bit red and inflamed because it's compressed. Gently retract that nerve to the side, and underneath you should find a round little herniated disc, and we then use a little micro grabber or a little hook to tease him out from there, and generally then the nerve should be nicely pulsing and free. We use a little hook to pass alongside the nerve. If you can pass that around nice and freely around the nerve, then you know the pressure is off that nerve, and then we suture together the muscle and the skin and then evaluate the patient afterwards. Hopefully most patients report near immediate pain improvement in the leg. Yeah, success rate is often difficult to predict because there's a lot of factors that affect the success rate. For example, how many nerves are affected? Is it 1, 2, 3, 4? Obviously, the more nerves that are affected by pain, the more difficult it is to correct all of them. Other factors that affect success rates: how long has the person had the pain and how disabled are they by it? So, for example, if a patient has had 15 years of severe leg pain and now the leg is very weak, that's going to take much longer to recover from than, say, someone who's had the same pain but only for 3 to 6 months. But generally, we would say the success rate for a single nerve compression from a herniated disc would expect around 80 to 85% of patients to improve following surgery by 6-month post-operative review. Yeah, so generally we wouldn't advise strict precautions after a discectomy in terms of movement, but because there's a small hole in the disc where we removed the herniated fragment from, that little hole takes around 12 weeks to fully close. So the commonest time for a disc to re-herniate is the first 3 months or 12 weeks after a microdiscectomy. So I usually tell patients to avoid heavy lifting and excessive twisting because that puts strain on the disc covering. Unfortunately, sometimes you still get disc recurrence even though the patient has really tried their best to avoid that. But otherwise, there's not really any major restrictions. In the UK, there's no set DVLA guidance on driving. It's basically if the patient feels recovered and they're not on strong painkillers and they can operate their vehicle, it's deemed safe to drive. Other than that, we usually say avoid swimming until your wound is nicely healed and the clips or sutures have been removed. Other than those precautions, we try and encourage people to mobilize and go for gentle exercise and walks as much as they can. Recovery from lumbar microdiscectomy is generally very good. The muscle incisions and retraction that you need is much less than in a fusion surgery like a TLIF or a PLIF. Generally, patients would need one overnight stay, and I would say 99 times out of 100, the patient is doing all their usual activities the following day, hopefully with no leg pain in the majority of cases. We'd usually advise gentle mobilization at home, and most patients by 4 to 6 weeks have minimal back pain and have returned to their usual job, except in cases where they may be a professional sports person or doing a very heavy job in, say, construction industry. We'd usually say don't do that type of work for the first 12 weeks. But otherwise, recovery from microdiscectomy is generally very favorable.